It is important to follow some fundamental rules before you begin. 1. Clinical history. Always know the patient's history before interpretation. 2. Verification. Check if the name, age, sex are correct. Right or left side is marked and view PA or AP is mentioned. 3. Technical quality. There are several technical quality assessments, of which rotation is the most important. In the subsequent slides, we shall see how to identify rotation in a chest X-ray. So in this X-ray, to find out rotation, you need to focus on the medial end of the both clavicles. So this is the right medial end of right clavicle. This is the medial end of the left clavicle. So right clavicle here, left clavicle here, and the spinous process is here. You can see this spinous process on here, here. So we'll take this at the level of the clavicle. The distance between this medial end of clavicle to the spinous process should be equal to this to the medial end of the left clavicle. So here it's not perfectly equal, because you will find that this distance is a little bit longer than this distance, but anyhow it is reasonably okay. So we can say it's reasonably well centered, because you can't get everything in like perfectly equal equidistance in all the x-rays, but as long as it is reasonably okay, then we can say it is well centered. Now look at this x-ray. You have this x-ray where on a superficial look you might find a sort of whiteness over here, right? So in the mid and lower zones of the right lung. And this patient never had any respiratory symptoms. This x-ray was done for a pre-anesthetic checkup. Finding this abnormality, a CT scan was ordered, and the CT scan was showing a normal lung parenchyma. Now the only reason for this sort of difference, because this whiteness and this darkness, the difference is if you look at this rotation here. So this is the spinous process up here, right? And you see this, the medial end of this clavicle, the right clavicle is up very close to the spinous process, but the medial end of the left clavicle is away, quite away. So because this X-ray is rotated, we have some darkness here and this sort of white. So even if there is kind of a mild rotation, it can create artifacts in the pulmonary parenchyma, and there's every chance that we may mistake it and interpret it wrongly. So that is the reason why rotation is so important, and before interpreting any x-ray, just spend a 1 second and just look at if both the medial ends of clavicle are equidistant. Now you have this next x-ray where first try to find out the clavicle. So this is the right clavicle and this is the medial end of the right clavicle. It is up here, right? And this is the left clavicle, and here the medial end of left clavicle is there. So this is the medial end of the right clavicle. Then you see, look for the spinous process. It's almost the spinous here, right? Spinous here, and you can also see the scoliosis of the spine, right? So and the spinous process is somewhere here. So now you can see it is grossly rotated because spinous process is here and one of the medial end is here and another medial end is here. So it's obviously rotated. So when this is rotated, we may not be able to confidently interpret the findings in the X-ray. Now we have this huge what appears to be a cardiomegaly, but we can't be sure because whether this opacity here, this whiteness here is because of the rotation is another consideration. So the whole X-ray is rotated towards this side because this side is the longer side. So this side, so this could be a superimposed shadow. So this rotation makes it difficult for us because we are confused whether it is a cardiomegaly or is it because rotation. So these sort of x-rays, when you see, you have to go back and ask the radiographer to do another x-ray for you to be confident in your diagnosis. Again, we are seeing another x-ray with similar presentation where this is the clavicle and this is the middle end of the clavicle up here, and this is the left clavicle, middle end of the left clavicle is here, and the spine is here, and so spinous process should be somewhere here, right? So now again it is grossly rotated, and there's so much things coming up, and there's no reasonable interpretation possible. So again, here also, if you feel similar x-rays, just call the radiographer. Make sure that you are taking a reasonably well-centered x-ray, and only then interpretation is possible. Otherwise, if you interpret, you may end up wrongly. So that is the importance of rotation, and it is one of the technical quality assessment marker. So after you complete this course, you need to employ the skills learned daily by taking a little bit more interest in chest x-ray during your daily rounds. Only with that sort of daily deliberate practice during your rounds can you achieve a level of mastery. As with everything, time and effort, you would become confident and proficient in chest x-ray interpretation. All the best and happy learning.